HIV, or human immunodeficiency virus, attacks the immune system and is found in blood, semen, vaginal fluids, rectal fluids, and breast milk. For HIV transmission, these fluids from an HIV-positive person must enter the bloodstream of someone who is HIV negative. This doesn't happen through air, water, hugging, or sharing food. HIV needs a direct route. The virus enters through mucous membranes in the vagina, rectum, penis, or mouth, or through cuts and open wounds. Sharing needles is especially risky because it introduces infected blood directly. HIV is not spread by saliva, sweat, or tears. The virus concentration is too low or non-existent in these fluids. You can't get HIV from kissing, toilet seats, or mosquito bites. Transmission requires three things: a fluid with enough virus from someone with HIV and a direct way into another person's bloodstream. Sexual activities are assessed based on whether these three conditions are met. This explains why some activities are riskier than others. Understanding these basics is the first step in protecting yourself and others. When we talk about oral sex, we're evaluating how likely it is for these conditions to be met. This framework helps us separate fact from myth and focus on real prevention. Knowing the actual routes of transmission reduces unnecessary fear. Let's look at how this applies to specific sexual activities. Oral sex means using the mouth, lips, or tongue to stimulate a partner's genitals or anus. The main types are mouth to penis, fellatio, mouth to vagina, cunnilingus, and mouth to anus, analingus or rimming. In all these, the person performing oral sex is at potential risk, as their mouth's mucous membranes may be exposed to fluids that can carry HIV. The risk for the person receiving oral sex is virtually zero. Saliva doesn't transmit HIV. For fellatio, semen or pre-seminal fluid can carry HIV, but the risk remains very low. For cunnilingus, vaginal fluid is the concern, but again, the risk is low. Rimming carries a low risk due to possible contact with rectal fluids or blood, but also exposes you to other infections. The pattern is clear. The performer is at low risk, the receiver is not. Saliva's inability to transmit HIV is key to this distinction. Understanding these differences helps you make informed choices. Most importantly, oral sex is much lower risk than unprotected vaginal or anal sex. Let's explore why the risk is so low. The mouth is a tough environment for HIV. Saliva contains enzymes that break down the virus. The oral lining is thicker and less permeable than genital or rectal tissue, making it harder for HIV to enter. Unless there are open sores or wounds, the mouth is a strong barrier. The amount of virus in fluids during oral sex is usually not enough to cause infection. Most HIV cases are linked to unprotected anal or vaginal sex or sharing needles, not oral sex. Documented cases of HIV from oral sex alone are extremely rare. While possible, transmission through oral sex is an exception, not the rule. This perspective helps keep the risk in context. Certain factors can raise the risk of HIV transmission during oral sex. Cuts, sores, or bleeding gums in the mouth provide direct entry points for the virus. A partner with a high viral load, especially if untreated, means more virus in their fluids, increasing risk. Other STIs, like herpes or syphilis, can cause sores or inflammation, making transmission easier. Semen and menstrual blood carry higher concentrations of HIV than other fluids. Swallowing semen or contact with menstrual blood slightly increases risk. These factors can raise the risk from very low to low, but still far below that of unprotected vaginal or anal sex. Awareness of these factors helps you take extra precautions when needed. You can make oral sex even safer with simple strategies. Use condoms for fellatio and dental dams for cunnilingus or rimming. These barriers block contact with infectious fluids. Flavored condoms and dental dams are available for comfort and taste. Avoid oral sex if you or your partner have mouth sores, bleeding gums, or genital sores. Letting these areas heal closes potential entry points for HIV. Regular testing and open communication with your partner about sexual health are essential. PrEP is a daily pill for HIV-negative people at risk, and PEP is emergency medication after possible exposure. These medical tools add powerful layers of protection. Combining barriers, good health habits, and biomedical prevention makes oral sex extremely safe. Prevention is about being proactive and informed. U means a person with HIV who maintains an undetectable viral load on treatment cannot transmit the virus sexually. This is proven by major studies, thousands of couples, zero transmissions. U applies to all forms of sex, including oral. This knowledge reduces stigma and empowers people living with HIV to have healthy relationships. Adhering to treatment keeps the virus suppressed and protects partners. For HIV-negative partners, trusting UU means confidence in your safety. U is a cornerstone of modern HIV prevention and a message of hope. Treatment is prevention. Science confirms it. To sum up, HIV transmission through oral sex is possible but extremely rare. Saliva and the mouth's lining provide strong natural protection. Risk increases with mouth sores, high viral load, or other STIs, but practical steps can reduce it to nearly zero. Barriers, good hygiene, and avoiding oral sex with sores are simple, effective strategies. UU, PrEP, and PEP offer additional reassurance and protection. Most new HIV cases come from unprotected anal or vaginal sex, not oral sex. Oral sex remains one of the lowest risk sexual activities for HIV. Understanding the science lets you make confident, healthy choices. Sores in the mouth increase risk, so good oral hygiene is important. Dental dams provide a protective barrier and lower the risk of HIV and other infections. Open communication about health status and preventive measures is vital, especially in serodiscordant relationships. Taking these steps helps maintain a healthy sexual relationship. Analingus, or rimming, has a low risk for HIV but higher risks for other infections like hepatitis A and intestinal parasites. HIV transmission is rare, but mouth sores or gum disease can increase susceptibility. Dental dams are effective in reducing risk by preventing direct contact with rectal fluids. Regular health screenings and honest discussions with partners help manage risks. Prioritizing safety ensures a healthier sexual experience. Receiving oral sex presents a very low risk for HIV transmission. The main concern is other STIs, especially if the partner performing oral sex has mouth sores or gum disease. Using condoms or dental dams protects both partners from HIV and other infections. Good oral health and regular STI screenings are important preventive steps. Open dialogue with partners supports safer sexual practices. Several factors can raise the risk of HIV transmission during oral sex. Cuts, sores, or gum disease in the mouth provide entry points for the virus. A higher viral load in the HIV-positive partner increases transmission risk. Effective ART and an undetectable viral load drastically reduce this risk. Other STIs can cause inflammation or sores, making HIV transmission more likely. Prompt treatment of STIs and good oral hygiene are essential. Using barriers and regular health checkups further lower risk. Preventing HIV during oral sex starts with using condoms or dental dams to block contact with bodily fluids. Flavored options make protection more comfortable and appealing. Maintaining an undetectable viral load through ART is highly effective. U. Open communication about sexual health, STI screenings, and HIV status is crucial. Pre-exposure prophylaxis, PrEP, is another option for added protection. Consult a healthcare provider to see if PrEP is right for you. Combining these strategies offers the best protection. Understanding the risks of HIV transmission can sometimes feel confusing or even intimidating, especially with so much information out there. But remember, gaining knowledge about how HIV is transmitted and how it isn't is one of the most powerful tools you have to protect yourself and those you care about. When you take the time to learn, you're not just reducing your own anxiety, you're also empowering yourself to make informed, confident decisions about your health and relationships. It's completely normal to have questions or even worries, but seeking out accurate information is the first step toward peace of mind. It's important to know that oral sex carries a much lower risk of HIV transmission compared to vaginal or anal sex. However, that doesn't mean there's no risk at all. Using protection, like condoms or dental dams, can further reduce the chances of transmission and help you feel more secure. Taking these precautions shows that you care about your own health and the health of your partner. It's a simple step that can make a big difference, and it's always worth the effort. If you ever feel uncertain or have specific concerns about your situation, don't hesitate to reach out to a healthcare provider. Medical professionals are there to answer your questions, provide up-to-date information, and support you in making choices that are right for you. No question is too small or unimportant. Your health and peace of mind matter. Whether it's about testing, prevention, or just understanding your options, talking to a professional can help you feel more confident and less alone. Open and honest conversations with your partner about HIV status, testing, and prevention strategies are key to building trust and maintaining a healthy relationship. These discussions might feel awkward at first, but they show respect and care for each other's well-being. When both partners are informed and involved, it's easier to make decisions together and support one another. Remember, talking openly about sexual health is a sign of maturity and responsibility, not something to be embarrassed about. Practicing safe sex is a shared responsibility between partners. It's about looking out for each other and making sure that both of you feel safe, respected, and cared for. Supporting one another and making healthy choices strengthens your connection and helps create a foundation of trust. When you work together, you're both taking steps to protect your health and your relationship. Staying informed is an ongoing process. Take advantage of reliable resources, read up on the latest information, and don't be afraid to ask questions, whether it's online, through brochures, or by talking to professionals. Using protection consistently and seeking advice when you're unsure are simple but effective ways to stay safe. Remember, your health is worth the effort, and there's always support available if you need it. By taking these steps, learning about HIV, communicating openly, practicing safe sex, and seeking guidance, you're setting yourself up for a healthy, fulfilling, and confident sexual life. You deserve to feel secure and empowered in your choices, and with the right information and support, you can enjoy your relationships to the fullest.